Only I'm neuro spine surgeon at Kauvery, and I head the department here. So here we got one interesting child. The child is now 18 days or 20 days? 20 days. So 20 days old. It's a child who was referred to us from a private medical college. Born, diagnosed with a tumor at the time of pregnancy itself. So 20th week scan, they had actually identified that the child had a very large tumor. So the child had obviously gone to various places for scan. Some people had advised them to abort the child, thinking that it is a tumor arising from spinal cord. But then the child also went on to have an MRI scan in pregnancy. This is again very rare. So pregnancy time, very rarely few places they do an MRI scan of the baby. So they did an MRI scan which detected that this tumor was coming very close to the spinal cord, and it was grown very big at about 30 weeks. So anyway, the parents decided to have the child. The child was born with normal delivery, and after that the child was referred to us because they didn't have the expertise to do that in the private hospital. It's a medical college hospital. So the child we shifted on the 5th day after birth. We shifted the child, and then after that what we did is we had a discussion what this tumor could be. We had a few differential diagnoses of what it can be, either something coming from the spinal cord, or a tumor coming from the bone, or a tumor coming from the muscle. So it was a very aggressive looking tumor. We will pass around the photograph of the tumor. The tumor was actually the size of the child's head itself, a very large tumor, the size of the child's head. And after that, they obviously, after discussing with the family, they're not coming from a very affordable background, so they could not afford this surgery. So they were trying to see a place where they could do. So fortunately, we did this operation under the Tamil Nadu Chief Minister's scheme. So we were able to help them. Although it was a good 6 to 8 hour long surgery, and most private hospitals would not obviously do this kind of a tumor. So we done it. So what I suggest is we can send the child down back. So if anybody wants to see the child, you can see photograph or something. Surgery வந்து successfully பண்ணிட்டோம். It was a good 7 to 8 hour surgery. So in the whole team of doctors we were all involved. So I'm the spine surgeon. Dr. Shivashankar is the pediatric surgeon. Dr. Satish Manivil is the plastic surgeon, and Dr. Lakshmi is the pediatrician. So it's very small children, babies, you need a very specialized team.
This time சார் பார்த்தேன், நம்பிக்கையாக சொன்னார் 100% க்யூர் பண்ண முடியும் அப்படின்னு சொல்லிட்டு எக்ஸலண்ட்டாக சேலஞ்ச் பண்ணி இந்த ஆப்ரேட்டை சக்ஸஸ்ஃபுல்லாக முடிச்சிருக்காரு. நாங்கள் பயந்துட்டு இருந்தோம், இந்த மாதிரி ஒரு டியூமர் இருக்கிறதுனால குழந்தை என்ன பிரச்சனை வரும் அப்படின்னு சொல்லிட்டு. மேக்ஸிமம் ஒரு 5 kg கெயின் ஆனால் தான் குழந்தை ஆப்ரேட் பண்ண முடியும், ஆப்ரேஷன் பண்ண முடியுன்றதுனால மாறி சின்ன 20 days சில்ட்ரன்ஸை குழந்தை சக்ஸஸ்ஃபுல்லாக ஆப்ரேஷன் பண்ணியிருக்காங்க. ரொம்ப டேலண்டடாக பண்ணியிருக்காங்க. Thanks for helping.
Any idea if the tumor was
teamwork? எல்லாரும் சேர்ந்து பண்ணோம், and the child is fine. So probably 2 to 3 days we'll be discharging the child. We are still waiting.